A warm welcome, dear viewers. Nice that you tuned in again to us on Health Television. And the focus of our conversation today is knee problems or joint problems in general, and how can such joint problems be solved? Because I'll say the conventional or the classic treatment often does not bring the effect one actually wishes for. The pain one still has and for longer, and we will soon experience a patient who talks about her story, and we will also hear what helped her. And with us is also, of course, the corresponding doctor, Dr. Harald Burgard. He is a specialist in internal medicine, and we will also naturally hear more from him about this therapy path he chose for the patient. So stay tuned, it will be exciting. I look forward to you and, of course, my guests. So, hello dear Harald, greetings. I welcome you first of all, but of course, we want to move on to your patient right away. Joining us in the studio via Zoom is Ms. Ellen Walter. A very warm welcome to you. Thank you for taking the time to join us.
Hello, my name is Ellen Walter. I have been experiencing pain in my left knee for about 6 years. I have repeatedly gone to an orthopedist. He then suggested hyaluronic injections.
May I interrupt you briefly, what was actually the exact diagnosis?
Arthrosis, so not so bad yet, but ultimately I couldn't kneel down at all anymore. I also couldn't lean against the bed while making it, or make the bed very carefully. It just hurt really badly. Later, even just wearing jeans pressed on the knee and hurt, so I preferred wearing skirts. Then I received hyaluronic injections every 6 months. They worked wonderfully, but a hyaluronic injection also costs just 4 or 5 years ago, 200 euros. Every half year it's 400 euros, and that's not insignificant either. You can also get an infection from the hyaluronic injection into the knee. Exactly, it can happen that you get an infection. And then I heard from Dr. Burgard that he offers gold implants and that they prevent infections. I discussed this with several people who have already done it with him, and they were all enthusiastic. Then I decided to take this step too. I was a bit anxious that a lot of money would actually help as well. Dr. Burgard said you only see the success in half a year. But within 4 weeks, I had no more pain in my knee. And that has remained the case to this day. And now I've decided to have my second knee repaired next week as well.
Okay, repaired. Yes, great. So, let's note once again that the classic therapy with the hyaluronic injections was firstly expensive and not sustainable, obviously, because it had to be repeated again and again. It was helpful, as you say, but ultimately, one looks for a sustainable solution, which brings lasting success and isn't constantly revisiting the whole issue when the pain returns. And that has been achieved. Wonderful.
How was the operation for you, or the procedure? How did you feel about it? Were there any problems afterward, or were there any periods where you had to take a break?
No, so it hurt less than the hyaluronic injections. There were about 30 small gold beads implanted above the knee, and I went home immediately. It was, well, apart from the injection sites, which looked like blue dots for a few weeks, but no pain at all, absolutely nothing, simply laughable. So, with pain here...
How long ago was that?
Well, Dr. Burgard would know better, I think 4 years. Or no, I know exactly, my mother had her house sold and she financed the whole thing, so for about 2.5, 3 years.
That sounds, of course, now as if we were in the 6-figure range. So a gold implantation, to maybe say this for the patients, costs around 2480 euros, around that. So that's not a small amount of money, but it's also not exorbitantly much.
If you look at it precisely, 2 iPhones and I'm in too. And an iPhone I have to replace after 2 or 3 years.
Yes, exactly. And usually one treatment is enough, because the gold stays inside for a lifetime and the effect remains as well. It doesn't wear out.
Aha, very good, wonderful. Yes, so then enjoy your life again and now you can move well again. Except for the other knee, that's still pending.
Excuse me for this interruption, but please, it serves not only us, but also the promotion of this broadcast, if you subscribe to this YouTube channel now. Thank you very much, and continue to have fun. Goodbye, everyone.
Yes, exactly. So it doesn't even look that stupid on the beach now when you stand up or sit down and can't use the knee.
And you also had osteoarthritis behind the kneecap, which then also led to pain when you leaned against the bed. Is that gone too?
Yes, it's just fantastic. So I can only recommend it to everyone.
Okay, wonderful. Yes, then I would like to say a big thank you, dear Mrs. Walter, for answering our questions and for being able to give such an enthusiastic feedback. We wish you, of course, now for the second procedure, which, as we have already heard, the first one was also not complicated at all, and apparently also not painful, and you can simply start walking again right away. So, it doesn't get much better than that. Then I wish you equally wonderful success for the second procedure, and that you may walk happily on 2 legs for a long time.
I thank you.
Thank you very much.
Thank you very much, Mrs. Walter. Bye.
Yes, dear Harald, that was now a great feedback for this therapy that took place here with the gold pellets. She has, I believe, said something, 30 gold pellets she had implanted?
Yes, there were a few more. You can see below in the picture, you can still see the surface on the side and here above. And then we also treated the inside, because that's where she actually had the pain. On the inside and here under the kneecap. And at least 54 little pellets were placed.
Okay.
That's roughly the average we do, sometimes even more, depending on how many points need to be treated. And these gold pellets, they basically stay in place for life. And because it's pure gold, there's fine gold in it. We've never seen an allergic reaction, nor read any statement anywhere worldwide that there were issues. Gold implantation, for those who are listening but aren't familiar with it, is nothing new. It's been around for over 40 years. And if you have joint osteoarthritis, then the joint space narrows here. It gets thinner and it becomes increasingly difficult to even inject hyaluronic acid. Furthermore, as she just said, it's not entirely without risk, because I have to always go inside the joint. And when I inject something into the joint, then I have always, of course, the risk of germ exposure, that the joint becomes inflamed. And in higher grade osteoarthritis K3 and 4, hyaluronic acid does not bring any lasting improvement, nor any longer improvement. When we work with gold, we work differently. We do not put the gold into the joint space, but we place the gold externally on the capsule. Because the joint capsule is the area that essentially transmits the pain and inflammation. And when you place gold there, cells from the connective tissue come and release particles from the gold. And these gold particles that are released are taken up by the inflammatory cells, which means they no longer release inflammatory mediators. And when no inflammatory mediators are released, the inflammation decreases, the swelling decreases, and so does the pain, and permanently. And the nice thing is, at first, one can, only work under local anesthesia, then get up and can, normally. Yes, exactly. So this is purely local anesthesia. The patients talk to us, with me and my team, during the operation. They get up afterward and go home. They can even go shopping afterward. Yes, we don't need any sick leave or anything like that the next day. And the gold works, as I said, permanently. However, it doesn't work immediately. That means until this dissolutosis, so this dissolution of the gold particles, has progressed far enough that the pain relief occurs, it takes a few weeks. I always tell people between 3 and 6 months. If it then happens within 4 weeks, then happy. But if I say 4 weeks and it's not better after 5 weeks, then the phone doesn't stop ringing. Yes, and we know it goes slowly and the improvement continues even after a year and a half. And then at some point, a plateau is reached, and it stays there. But then permanently, yes. And if you then overexert yourself or overdo it, like, I don't know, dance through the night, or go on an especially tough, strenuous hike, and the knee hurts more again, then we know, both from the patients, that it gets better after 1 or 2 days. But we also know from science that the body actually releases a bit more gold, and then this release decreases again, and then the pain goes away again. So that's what people have been telling us for a long time, which has also been proven in scientific studies. And you don't need, and this is also a criterion for many, not only a sick note, but you also don't need rehab afterwards, unlike having to go into rehab like after a knee joint surgery. What I do recommend, however, is always that people do muscle training afterward, because most are already weakened by the knee pain, as they haven't moved properly, they couldn't do any sports anymore, and nothing. And then the musculature deteriorates, and we sometimes see people whose muscles are in terrible condition. And when the effect starts, and the pain is better or goes away, then they can also do strength training again, and can rebuild the muscle in a targeted way, which also relieves the knee additionally. We recommend this to everyone. Or some people, if the capsule has already shortened, should simply have appropriate stretching exercises done by a physiotherapist to bring it back. The stronger the muscles and the better the mobility, the longer people can simply run. And it also prevents further damage. If I don't have any pain now, but I have muscular insufficiency, then it can affect the hip, the spine, the ankle joints, because you just hold yourself wrong, move incorrectly, and you can simply achieve a lot with reasonable training afterward.
Movement is, after all, the be-all and end-all above all. The older we get, the more important it becomes.
Absolutely. Simply to maintain the bone, to maintain the muscle, and also the joint guidance. The joint guidance is muscular and ligament dependent. And if this side is weak and that side is strong, then the strong one pulls, the weak one doesn't, and then it naturally leads to incorrect loading.
Yes, okay, you mentioned earlier that gold is lifelong, nothing wears out, but then you also said that gold particles are dissolved.
So a little bit is used up, but I put so much in there that they could never use it up in their lifetime.
Okay, that was important to know because I was thinking...
So some of it is used up, although what we don't find, which is also occasionally asked, we don't find that we suddenly find gold in the body. So there is not, it really all stays in place. And these inflammatory cells, obviously, too. These are local cells we're talking about. And we don't see, for example, in patients that I examine after 2 years, that they suddenly have gold in their blood or gold in their urine.
That it migrates in the urine.
It doesn't migrate, just as little as the gold particles migrate away. And since it's pure gold, it's also not magnetic. And because it's not magnetic, you can also do MRI. Magnetic stuff would fly out there. You can walk through airport security without beeping. If you get an X-ray, you might want to tell the radiologist that there's gold in there. Otherwise, they might think there was perhaps a war, because who sees nothing but shrapnel and can't explain it? But otherwise, it's an uncomplicated thing, because you can do everything with the knee. Theoretically, you could also go in still and give a hyaluronic acid injection. You can operate when a ligament is torn, operate on a ligament, so you can actually do anything, because the gold doesn't block anything there. These are very small particles that are distributed in such a way that you still have access to the knee without feeling it, without it restricting you in any way.
You say that this type of treatment has been around for a long time. But why has it then somewhat receded into the background in medicine? In veterinary medicine, it's still the case.
In veterinary medicine, it is quite widespread. In human medicine, a different path was taken, and with the possibility of replacing joints, that path was chosen. This is sometimes necessary, of course. There are sometimes very damaged knees where nothing works at all. But that's just how it's developed. In other countries, in some countries, there's more acupuncture. In Asian or Russian-speaking countries, they did more with lasers because they didn't have antibiotics. For us, more pills and antibiotics have been established in the therapy. These are just things that have developed somewhere along the way. That's okay too, but this here is an alternative where you can also avoid many possible complications.
I was just going to say it's probably also what burdens the body less than such an operation where an entire knee is replaced.
It burdens you basically as much as an injection.
Yes, I understand.
That's about it. And with knees, especially the knee joint, is a very complex joint, and 25% of operations fail and have to be repeated. Then the artificial joints don't last forever either. And you can't replace them as often as you want. So our goal is always either to avoid the surgery or to delay it, especially in younger people. And above all, to maintain mobility as long as possible. And you can get that wonderfully done with such a procedure. And you can, of course, not only apply this gold to the knee, but also to the foot, the hip, the thumb joint, the big toe joint, or the spine as well. If someone still has pain after disc damages, you can also apply gold to the facets, joint arthrosis, or even when people have osteoporosis and their bone is broken. That's possible too. Where it doesn't work is with bone metastases from tumors. It doesn't work there. But with the other things, gold works very, very well.
Yes, it's not without reason one of the most valuable substances we know on Earth, with many great qualities. So not just as jewelry.
Gold is the most anti-inflammatory metal in the world.
Okay, fantastic. Where can you learn more about it?
So yes, you can go to my website, www.darkbilger.de, or of course Google my name on the internet, and you'll find me there.
Okay, wonderful. Then I'll say thank you very much for the moment. I always find it great that you always bring in patients who share their own experiences live and who simply tell us from their perspective and from their experiences. Because if you haven't had a gold implantation yourself, I don't know if you have ever had one.
No, I haven't needed one yet, but my wife has received one.
Yes.
She was even on television once.
But then you simply can't talk about how you felt, how quickly it worked, and how the...
It's a bit different for everyone. There are people who call me a few days later. Hooray, hooray, hooray. Others have seen no effect, even after half a year. Then you have to wait 3/4 of a year. It depends on many factors, like how your immune system reacts and so on.
I understand.
But we always mention that. And every person is unique, and therefore there are differences. But in the end, it works. And we know from studies that for most people, it even brings improvements of 80 to 100%, even when there is 4th-degree osteoarthritis. And that's really a lot.
That's great. Yes, that's true. Okay, so I'll say once again a big thank you for this insight into gold implantation, and I wish you much success, and I look forward to more conversations and more of your patients with such great stories.
Thank you very much, Alexandra.
Thank you, dear Harald. Dear viewers, I also thank you for joining us. And once again, we have here offered a great solution, or rather, our studio guest, and maybe it is an option for you if you are affected, or feel free to share it. We would be glad. So stay mindful, stay vigilant, and above all, stay loving to yourself and the world. I am pleased when you tune in again next time. Until then, all the best to you. Bye.
Thank you for watching Swiss Health Television, QS24. Please don't forget to subscribe to the channel up here, because here you can watch all programs without ads, but also subscribe to our YouTube channel, as this is also very helpful to us. Here is a selection of programs compiled for you that may also interest you.